How's it going, everybody? Today we're here at Juventee with Angelique Miles. Angelique Miles has started services with us, and she has a lot of clients and followers that have a bunch of questions. And right now, we're going to share some of those questions with you, the audience, because you may have those questions as well.
Awesome.
Welcome, welcome, Angelique.
Thank you. Thank you for having me. I love it here. So I'm on HRT, starting with you guys, of course, and I'm on the pellets. And I'm often asked, you know, people have these preconceived notions about HRT,
Hmm.
and I tell them all those things have been debunked. If you can explain to people, um, besides high libido and other things,
Yeah.
what are the benefits of hormone replacement
Yeah,
therapy?
no, absolutely. And that's an excellent question because for 20 years, a study went on called WHI. And it was a study that was done that was practically debunked, like you mentioned, indicating that hormone replacement was terrible for women, not so much for men, and that it produced all of these side effects and adverse reactions. So that was clarified as of June 2024. FDA approved to remove those black box warnings for women. And now we're flourishing on true medical literature backing up how important it is for these hormones to be replaced and done properly, most importantly. The last thing we want is to not go to a medical clinic and get blood drawn and go through the whole process that comes with a proper consultation, making sure that the right treatment for the right patient. All this is very important, and we can't skip any of that when it comes to health. Um, the benefits of hormone replacement for both men and women. As we get older, we produce less hormones, and that's a natural aging process, and we know that. Muscle begins more difficult to produce. Fat distribution becomes off, and concentration, sleep, a little bit on the anxiety. All this comes from our receptors in our body because we'll have receptors, hormone receptors in our body until we die, right? And those receptors go to the glands. In females, organs would be ovaries, and male organs would be testicles. And they go to these glands and they come back empty-handed. When they come back empty-handed, hence the issues with these symptoms that present. So what we're trying to do is relieve those symptoms, but that's just short term. When we talk about long term, we're talking about bone health, especially for women, right? When we talk about long term, we talk about Alzheimer's, we talk about dementia, we talk about cardiovascular benefits, and all this is medical literature that's available to the public, and it's no secret, but we need to make sure that everybody is aware of that.
Awesome. They can explain it so much better than I can.
Yeah, yeah, yeah. So, I'm glad you asked the questions because I know a lot of people have those questions as well.
Yeah, like we've talked about, it's not one size fits all.
It's not.
You have to have extensive lab work done. So, you know what's needed.
Right,
Not
right,
everybody needs the same
right,
thing
right,
or the
right,
same amount of things.
right.
And
And in functional medicine, we call that personalized care because it has to be personalized,
right.
right? You have an activity level, you manage certain stress, sleep, bathroom routines. All this is very important, and we have to consider that
Right.
when we're talking to a patient. None of it is like, oh, I'm not going to talk about bowel movements. Bowel movements are just as important as eating. So, all this is very important, and we're professionals. This is what we do, and we want you to optimize your health to the fullest, not halfway.
Perfect.